Hello, today I'm going to talk about ADHD through the lens of structural family therapy. This is a typical family on its way to therapy. I'm going to talk about the application of structural family therapy with a family that has ADHD. As a structural family therapist, working with an ADHD child using structural interventions, I would ask the parents to sit side by side during a session. Typical family, little Billy has ADHD, and Jenny does not have ADHD. Mom Patty and Dad Jim are on their way to therapy. Billy is used to sitting between Mom Patty and Dad Jim, and so Mom Patty and Dad Jim always allow little Billy to sit next to them. As a therapist, I would explain that it's important for Mom Patty and Dad Jim to be a united front and to sit next to each other. Boundaries of its subsystems, and normalize and strengthen the role of little Billy in the family in their overall interactions. I would then ask him to be a consultant and help me understand how things work in his family. In many ways, the structure that I am providing by the placement of myself with the other family members as I join the family system in this kind of a session acts as a surrogate structure that the family can then therefore adopt outside of the sessions. And the more therapy we have, the more the family will start to feel like this structure makes sense for their family. And it really does put the family in a hierarchy that is appropriate. And it's adjusting the hierarchy that is in place. The thought behind structural family therapy is that once the hierarchy is firmly in place, the symptoms of little Billy for his ADHD will decrease. So another reason why I've chosen to draw a Ferris wheel in this picture is because I believe it to be very analogous of this model in general, and because as a therapist working with this family, I will be synonymous to the bar on the seat of the Ferris wheel that keeps everyone in place. I'm going to discuss ethical considerations to use with working with a family with a child that has ADHD. So let's get ethical. As a family therapist working with a child that has ADHD, let's say I evaluate a 6-year-old child, going back to little Billy, and we find out that little Billy is likely to be suffering from ADHD and a learning disability. I would like to distinguish and differentiate between the two. ADHD is not a learning disability. Then let's say I meet with the family and I provide a referral to a psychologist in the community so that they can have further testing. It's a really good idea for the testing to be as thorough and as concrete as possible. And I also try to recommend to people that they get multiple professionals looking at the child and assessing them in order to get an accurate diagnosis of ADHD. Several days later, let's say that the psychologist calls me on the phone and thanks me for the referral and suggests an ongoing relationship with me, because now the psychologist feels that I'm going to provide him or her with primo referrals. I'm going to really up and increase and boost their practice. And let's say that at this time the psychologist also decides to give me an increase of the percentage of what they pocketed from the referral I provided them with. As a therapist in this case, I should refuse to take the fee of the percentage that the psychologist is giving to me. I should refuse this offer because accepting fees for a referral is unethical, according to Section 7.1 of Financial Integrity in the AAMFT Code of Ethics. That's my first scenario. My second scenario is, as a family therapist, I should not misrepresent myself by calling myself a specialist of ADHD. That's very much a huge misrepresentation, And because of my influence as a therapist, people are going to believe that. So if I do not have the proper training and credentials to back up my claims, I should not make that claim. And I cannot conduct testing to confirm a child or an adolescent has ADHD because that's unethical. And that is unethical according to Section 8.1, Accurate Professional Representation in the AAMFT Code of Ethics. Finally, my third ethical scenario, which is important with ADHD to name, is, let's say as a family therapist that I'm working with a family, I really need to only make public announcements or public statements for treatment recommendations with the utmost caution. And because everything I'm making as a statement reflects upon myself and my ethics. So even though I may believe personally when I'm working with a family that has ADHD, that the more recommendations I make, the better the outcome, the better supported the family is going to be, the better it will be. I may think more is better. And so I really need to use my professional discretion to provide for the existing needs of the family and not think more is better, but simply look at the existing needs and the presenting problem that is coming to me from each family. And to know that I can't replicate my resources for every family just because the family has a child that has ADHD. Talk about is medical and treatment barriers. As you can imagine, a family that has ADHD, a child with ADHD, and is entering into guide treatment for their child is going to be faced with many different decisions. They're going to be, because ADHD is a medical diagnosis, they're going to be faced with the reality that perhaps at some time in the child's life, they may or may not need to be put on a medication to improve their attention and their ability to listen and to be more productive and calmer in school. These are typically stimulant medications that you would be putting a child on, such as Ritalin or Adderall. And with these decisions, as you can imagine, there are many different barriers. How can they pay for the medications? Will they have enough? Will the medication always be in supply? Is it in high demand? And when it is in high demand, the cost of many stimulant medications that have to be locked up actually goes up. And will these be covered for insurance? Will they not be covered for insurance? Medication is sometimes an easier alternative with ADHD than therapy, because a lot of people feel that it's really stigmatizing and it's just easier to give a child a pill and let's just fix the child. The way that structural family therapy really looks at it is, I'm not going to just fix the child. If you have a child that has ADHD and you come to me and you drop off the child and you say, okay, fix him to me, I'm going to say, I'm sorry, I can't just work with the child alone. I really need to look at your whole family and the whole context of the family in order to best provide you the most support, because I'm really going to look at the interactions between yourself and every single family member with the child. However, say that there are other barriers within the realm of medications, such as limited time. Many families that have children that have ADHD are constantly on the go. Maybe both parents work, maybe it's only a single mom, maybe there's different play groups, maybe there's different homeworks that they have to do for their child, or their child's involved in karate or other kinds of activities, after school activities. As I said before and kind of hinted at, access to therapy providers. So other times, parents or families will have certain preferences for treatment, and I kind of said that. and their preferences may change, and actually a preference can actually be a barrier for the child and for the family. Even when one of the studies I looked at was by Becerra and Michael Macri, and it was done in 2012, applying structural family therapy with a family, and the mother had multiple medical disabilities. She had 3 children, and one of the children, Jason, had ADHD. Some of the barriers and real treatment issues to treatment were missed appointments. As you can imagine, her having ADHD and some other medical disability made it very challenging to procure treatment for herself, for Jason, and for his other 2 siblings that had other issues with mental health. I think one of the children in the study, one of the siblings had depression, and the other one had anxiety. So each one's needs really depended upon the mother, who was a single mom, being able to drive them to therapy and in a consistent basis, on a regular basis, to make the appointments. Sometimes family events were a barrier because there were things scheduled for each of the different siblings on different days, and that was really a barrier. Transportation issues, because the reality is, with a parent that has a medical disability, maybe they don't drive, and maybe they don't have access to a car, and so maybe they're living in a rural area or a setting, and they have to walk for very far ways in order to catch the nearest bus or transit, and maybe the bus only comes once an hour. These are real barriers that people face that have children with ADHD, and they can really limit how much and when a family is going to be available to come in for therapy. If mom works 40 hours a week, she's not going to be available to bring the child in after school, and she might not want to do it on the weekends. So evening appointments are going to be likely what a lot of families are going to prefer. So the next part of this project is agencies to augment treatment with support in ADHD. And I live in Oregon, so we were supposed to do 3 different local agencies. And for me, I have chosen Educational Connections, which is located on 1012 Southwest King Suite 301, Portland, Oregon, 97205. Their phone number is 503-478-9727. The second agency is called ADHD Advantage, and they are located on 5234 Northeast Farmcrest Street in Hillsboro, Oregon, 97124. Their phone number is 503-459-2073. They offer. The third resource that I have is called Conquering Chronic Disorganization, and it's a learning group. It's located on 847 Northeast 19th in Suite 100 in Portland, Oregon, 97232. Their phone number is 503-563-7520. They offer, and there is also, within the Conquering Chronic Disorganization Learning Group, a couples ADHD group that meets every other Wednesday. In addition, the resources that I have found and I identify with ADHD is, the first one is called CHAD, and they stand for Children and Adults with Attention Deficit Hyperactivity Disorder. In Portland, there is a Portland chapter of CHAD that meets at the St. Vincent's Hospital, and they actually have night groups from 7 o'clock on Monday nights, and they really work on a lot of things, even up to career adjustment and employment. It's all kind of challenges that CHAD really provides on a career level. However, they also provide information about ADHD, and the information that they provide is geared to a number of different audiences, such as caregivers, parents, and adults with ADHD, and professionals. ADHD is a medical issue, and it is also hereditary. So if I did not say that before, in a family with the two kids, and we have at the beginning, we have Jim and Patty. It's probably likely that either Jim or Patty will have ADHD when it comes to little Billy having it. But ADHD is going to present itself a little bit differently for Jim or Patty, and it's more likely that Jim is going to have ADHD than Patty. The second resource I found is called ADHDandyou.com. And one of the things I really like about what they do and what they offer in their educational videos is it really looks at how ADHD is not the child's fault and is not the family's fault. They provide a dramatization of some daily issues around managing ADHD and what it's really like for the child. And then the third resource is called healthyplace.com/ADHD. Healthyplace.com is really looking at natural treatments for ADHD. My 4 peer-reviewed articles that support the application of structural family therapy with ADHD are as follows. I think I talked about Becerra and Michael Macri 2012, which was a single mother case study. And the key points in this article were looking at how joining, structural mapping, enactment, and addressing disability and medical issues are important when it comes to treating ADHD. Learning to create healthy boundaries between a parent and a child and children in general, addressing maternal depression and family economic factors, and nurturing sibling relationships were effective. Peer-reviewed article that I'm going to talk about is there's actually been 2 of them done in China looking at the structure of family therapy on behavior. And the first one was done by Mingfeng, Cao, and Rui in 2012. And it looks at the effective structure of family therapy on behavior and executive functions. Specifically, what was found is that in this study that structural family therapy can improve compulsive and hyperactive behaviors with children that have ADHD. And it's actually been more effective with compulsive behaviors versus hyperactive behaviors. And the third peer-reviewed article that I chose was written by Robin in 2014. It's called Family Therapy for Adolescents with ADHD. Is used to improve family relationships because, again, it educates family about ADHD, all the particulars about ADHD. It answers all of their questions about ADHD, and it provides principles for parenting an adolescent that have ADHD. It breaks the negativity through one-on-one time with praise and the use of tagging. And it breaks up different parental subsystems so that parents can come together as a united subsystem and praise their child in a unified fashion so that both parents are really involved with the child that has ADHD, and not one parent, like in the Becerra article, is more enmeshed with the child and the other parent is more disengaged. So it's really bringing together both parents so they can both be equally engaged, appropriately engaged, without being overly enmeshed in the child. The negative with positive communication, which goes really back to structural family therapy, looking at how they can support the family, how the family can be positive in its communication, and still be able to be a family, still be able to come together in a positive fashion, even when they're stressed out, even when things are not going the best for them, even when their child that has ADHD is really grating on their nerves, and to know that it's not the child's fault and that they don't need to scapegoat the child. I think I said this was another one from China, was written by Zhu, 2013, and it was published in the Chinese Journal of Child Healthcare, called Structural Family Therapy on Family Environment with ADHD. And so obviously a big thing about structural family therapy is structure, and providing adequate structure and routine for children that have ADHD is paramount. It's huge. It will really teach a child with ADHD what to expect and what is coming next. And if their environment is cleaner, is more organized, is less in a chaotic fashion, it's easier for them to sort of control their impulses. It's easier for them to know what to expect, what's coming next. So now I want to kind of switch gears, and I also want to talk about helpful tips. The first one is accept the fact that your children, like all children, are imperfect. I would say that to all parents with or without a child that has ADHD. So do your best to love your child unconditionally, with or without ADHD. Treat him or her as if he were already the person that you would like him to be. Don't believe all the bad news about your child. People think I've yelled, I've lectured, I've threatened, I've given timeouts, I've taken away toys, I've canceled outings, I've bribed my child, I've begged my child, I've even spanked my child, and nothing's getting better, and nothing works. But there's definitely a problem with this approach, and any child exposed to such a variety of these things would be confused. So when you are talking about a punishment, make sure that the punishment is appropriate, of a consequence. It's not over and it's not under, and you're not just seeking to do something because it's supposed to be a punishment. Certainly it has its place, but it should never involve any physical or verbal abuse to the child, and it should always be used as a last resort.